Michael McNamara, the independent TD, former chairman of the Oireachtas COVID committee when it was in place, joins us as well. Michael, is this the correct approach, though, given that a lot of people think that the problems that we've had in January and February this year were brought about by a premature opening up of business and jobs in November and December?
I accept that a lot of people say that, but I think it's very simplistic to say that because, we had this huge escalation in prevalence and transmission of COVID-19 in Ireland compared to any other country in the world. I mean, it was spreading faster than anywhere else. And I think we have to ask why that was and how much this sort of pent-up desire to meet people resulted from this much longer and much more stringent lockdown than we have had than any other country. I mean, we had this Let's Save Christmas campaign, which I think was dreamt up by members of NEFIT, and which created this idea that if we locked down one more time that we'd be able to save Christmas and have something like a normal Christmas. Now, I do appreciate that NEFIT, lots of public health doctors and the government themselves said, you do need to adhere to the limits, but nevertheless there was an expectation created in the population that if we locked down one more time that we'd get to the end of this and we'd be able to have a normal Christmas. That expectation had disastrous consequences that we know about, obviously, but I fear that, the longer this goes on, the more pent-up need there is to socialise. I mean, we've had two plans now called Living with COVID, neither of which really, to me, are about living with COVID, and we do need to start trying to live with COVID and start trying to cope with it, because it's not kind of a wealth, in my view anyway, not a health versus wealth argument, because ultimately it is our economy that pays for our health system, and we already have an inadequate health system compared to many countries in Europe, which is one of the reasons that we've had all of these lockdowns. We are going to have an economy that can pay for the health system that we need, which has to be obviously a lot better than the health system that we had. So, we're in a vicious cycle in my view. There's also the massive borrowings that the government are undertaking to bail out sectors that have been shut down in a way that they haven't been shut down in other countries. We know that money is cheap at the moment, but when it has to be refinanced, and it will have to be refinanced, it might not be cheap. And, in 2019, we had close to full employment in Ireland, but we barely ran a surplus because of the cost of our existing borrowings. So I do fear for the future of the country if we continue along this path for much longer, and I don't think that it's as simple as saying it's health versus wealth, because the two are interdependent. There have been studies by economists, for example, in the University of Bristol, which have suggested that in times of recession in Britain, life expectancy doesn't increase. In times of a boom, it does. So there will be days of life lost. I mean, we're constantly told, and I agree that of course every life is precious right to the end of it, no matter, but life expectancy has increased dramatically since, consistently along human development. At times of economic development, it doesn't increase. In fact, sometimes it decreases in times when there isn't money for a health system. I mean, it's not that long ago in Ireland, and there are several countries in the world still, where you see a doctor if you can afford to see a doctor, because the state can't afford to pay for doctors. We're already being told that the Irish state can't afford to pay doctors enough and can't pay enough for the health system, hasn't been providing the health system we need. And I think we need to concentrate more on that. And these criteria that have been outlined, on the face of it, seem very reasonable, but this idea that that one of the criteria for opening up will be getting rid of the, or at least reducing the waiting lists which has been built up. I mean, waiting lists have been a huge problem in Ireland for a long time, and I mean, I think we haven't looked at that enough, and the consistent failure, and there are 4 Ministers for Health or previous Ministers for Health in this cabinet, including the Taoiseach and the Taoiseach, who presided over a health system which was inadequate, and they were now paying the price for that.
But Michael, a listener here says the UK is willing to have 30,000 deaths to reopen its economy. That's actually what the government has been warned, Boris Johnson's government, that what might be described as a premature reopening of the economy will lead to 30,000 additional deaths as a result to COVID. That listener says that would equate to about 2,000 deaths in Ireland. Would we do the same? Now, this listener says no, not with the cowards running the country, but could we really actually start opening up if it would result in thousands of additional deaths?
No, but it's not about thousands of additional deaths. It's about investing in a system that enables us to live with COVID, increasing our hospital capacity and increasing our healthcare capacity. And I know that that's not going to be done overnight, but we're a year into this now and we've seen very little increase in capacity. I mean, I'm going to talk about the Midwest because it's where I know best. I mean, we have the most consistently overcrowded A&E in the country in Limerick, and we've been talking about additional services before Simon Harris left the Department of Health or was moved from the Department of Health. He finally accepted that we needed to provide more medical services in the surrounding hospitals like Ennis, Nina and St. John's so that people weren't being funneled into an overcrowded A&E. I received assurances that a business plan had been put forward in respect of Ennis, and I'm still trying to find out what's in that and what additional capacity is being provided. So, we have to deal with the short term, but we also have to start looking at the long term, because at least in Britain, they have accepted that COVID-19 is not going to be eliminated, that a zero strategy is not feasible. Even if we take a different approach, it's going to be very hard to follow a different approach with an open border with the United Kingdom. And as members of the European Union, where there are a large number of people in Ireland who are linked to firms like Google, Facebook, etc., which are wealth creators. They pay huge amounts of tax that help fund our hospital system, our healthcare system. But a lot of their employees are here on the basis that they will be able to see their family if they're sick in Italy or Spain or wherever whatever their country of nationality is. Okay. And there's a question mark over their continuation in Ireland indefinitely if we continue with the policies that we have been pursuing up to now.